As you're nearing retirement and you have all those questions as far as when to take Social Security, how will the taxation of my Social Security be impacted from any other income that I have? Will I owe more? Will I owe less? Where's the threshold for it becoming taxable at the state that I live in? What kind of estate plan do I need? Do I need a will? Do I need a trust? I have children that from both families. We have a blended family. We're worried that we're going to disinherit someone. We don't want to disinherit them. Or what are my Medicare options? I mean, we get that question all the time. And really, how do you know you're ready to retire unless you have all the answers to your healthcare questions you have? And we've got Mark Benefiel here of Market Medicare Advisors, and you've got a story about Jeff this week, right?
That's right. I met Jeff and his wife. I believe it was Connie. They came to a Medicare seminar, and like a lot of folks that come to our seminars, they have some questions that they already want. I mean, they're looking and seeking advice, and so holding them off with some of the more detailed, specific questions is usually difficult until the end. But we're able to have a chance to talk to Jeff a little bit, learn a little bit about the situation. He then requested to come into the office, like a lot of people do. So we met with him and his wife here in the office. And the question he had was, my employer in retirement has a lump sum retirement benefit as part of their retirement package. And I say lump sum, I mean basically monthly. He gets an amount monthly that he can utilize in whatever way he needs to for retirement in healthcare. So the questions were, how can I use that? Can I use it to pay for a supplement? Can I pay my Part B premium with it? Et cetera. And so we worked through the different scenarios with him and found out that, yes, he could, utilize it. He'd probably be better off utilizing it towards his Part B premium because he hadn't actually taken Social Security yet. He retired from his employer, but he hadn't taken Social Security. And so what do I do with that money? So normally a lot of people take their Part B premium directly from their Social Security check. So it made a lot of sense for him to utilize it that way. But then the question came up, okay, when I do turn 65, when I do retire from completely from where I take Social Security, how is this lump sum going to affect my income, and is it going to cause me to have to pay an income adjustment based on my income from my Part B and possibly my Part D premiums as well? And so good question. So I didn't have the answer to that, which as I explained to him, I'm probably not the best person to take tax advice from. So of course, as always, I'm very fortunate to have our chief tax advisor, Jonathan Sikora, right next door in my office. Literally, we share a wall.
Jonathan Sikora? I think Joshua.
Joshua, excuse me. You're right, Joshua. It is Joshua. I mean,
Jonathan McCoy loves Joshua Sikora.
That's cool. Yeah, we should roll them up into one.
Yeah, I mean, totally.
Save a little FTE that way, maybe. Who knows? But Joshua, exactly. So, we share a wall. So I was able to just go around the corner and ask some questions, get him involved in the conversation as well. And now I understand they're now meeting to do some tax planning and stuff going into the future, making sure that he's utilizing the funds that are available in conjunction with figuring out the retirement dates and Social Security ramifications. And it gets very, very, very involved. And I think you hit it on the head earlier. How do you make those plans when one of your largest expenses, and we have a lot of data that show that not only is your income going down, but the percentage that you're going to spend on healthcare and retirement goes up exponentially, especially as you continue to age.
And you think it's common, most Medicare professionals or advisors out there or agents, however you want to call it, most healthcare agents out there, do you think they have a CPA in-house where they can answer tax questions like this?
Oh, I think a lot of them barely have any Medicare training, much less any training with around taxes for sure.
Sugarcoat it a little bit, please. So when you get this guy that comes in, Jeff and his wife, they came to this class. That's how a lot of people that are looking for answers, they go to these classes because ultimately, you can search the internet for things, but have you ever searched the internet? Have you go, hey, Mr. Internet, what do I not know?
Exactly.
Because it doesn't work that way. You have to know something. So people that come to these classes, they just get a baseline understanding, and then when you guys meet with them one-on-one, you dig into more of their situation and tailor the conversation more to their needs.
Absolutely. We've there are some people that come to our seminars who have done a really, really, really good job of doing a lot of research. I find that those folks are usually very detail-oriented people in their lives anyway, and so they're out getting the information. A lot of times what they come to a seminar for is confirmation confirmation of what they've already learned. And then along the way, they find some nuances that they didn't know. They know A, B, C, but there's also a D, E, and F that they didn't know to look for because, like I said, they didn't know how do you find something that you don't know that you're not supposed to look for.
And IRMA, I think I talked to you, I think I told you this 2 or 3 weeks ago. I was teaching a Social Security class, and a guy at the back of the room raises his hand. I said, yes, sir. He goes, I'm a Medicare broker, and I've never heard of IRMA. That's scary.
Yeah, it is. On one hand, it's kind of a love-hate relationship with other agents sometimes. There's some very, very good ones out there. I've learned a lot from some, but also undoing some of the information that they give or some of the half information or not knowing it all. There's nothing wrong with not knowing something. The problem is when you pretend that you know it, right? I on a daily basis, I'll say something. You know what? I don't know that answer. Let me look that up. And sometimes it's simple as looking it up right in front of them. Another time it's staffing it with one of my other colleagues here in the office, or in the case of things like taxes or trusts or estate planning, whatever it is. We have the luxury here of what we've been able to create and finding those answers within the building and getting that answer very quickly.
So not only should you and I be very glad that this is predominantly a radio show, but you and I both kind of have shiners. Mine's above my left eye, and yours is above your right eye.
My right eye, yeah. I took a header when I was out running this weekend when it was -5 degrees and smacked my head on the concrete.
Just slip on the ice?
No, I just tripped on the sidewalk, actually.
Well, that explains why you're calling Jonathan Joshua Sikora or Jonathan Sikora or whatever.
I may have a mild concussion. Who knows?
Well, is that covered under your Medicare plan?
I believe under my new health care plan. I'm not on Medicare yet, despite the beard. Thank you, Matt. I'm going to have a few years left.
All right. But this is just one of many, many stories that we tell every week of if you don't have a complete team helping you, what are you missing out on? Reach out right now, 833-888-HOUR, or that's 833-888-4687, or hop on over to the website, retirehour.com. Check out past episodes. You can actually see what we look like here in studio, and sometimes we wear some crazy outfits. I think you had a pretty crazy outfit on Christmas on TV show. But
wait to see my St. Patrick's Day get up.
We want to help you guys with all these questions you have in retirement and make sure you're getting answers before you maybe even need to ask the question. We'll stay tuned. We'll be right back after this.
Got retirement questions? You can submit your financial questions to be answered by the Retire Hour team by going to retirehour.com and clicking Submit a Question. We may even answer your question on air. Visit retirehour.com to ask your retirement questions today.